of posterior compartment of the thigh, they are called the hamstring muscles. Now, can you tell me, are these muscles belonging to flexor compartment or extensor compartment of lower limb? Muscles of posterior compartment of thigh, is it flexor compartment or extensor compartment? Yes. Yes, see, in the upper limb, anterior compartment muscles are flexors, whereas posterior compartment muscle are extensors for upper limb. Whereas for lower limb, it is the reverse. For lower limb, anterior compartment of thigh, which is the quadriceps, they are the extensors of the body. Whereas the posterior compartment of thigh, they belong to flexor compartment. This is because of a difference in the way the upper limb and lower limb are developing embryologically. So that you will learn later in development of limbs. So please keep in mind that posterior compartment muscles, they are the flexor compartment. Now, why are these muscles called hamstrings? Just a point of interest. Does anyone know? Why are these muscles called hamstring muscles? Okay. While you think about that answer, I'll just name the hamstring muscles. Okay, in the lateral aspect, there is the long head of biceps femoris. You all know the muscle biceps brachii in the upper limb, which has a short head and a long head. Similarly, in the lower limb, there is the biceps femoris muscle. And on the medial aspect, okay, there are two muscles, semitendinosus and semimembranosus muscle. Okay. And out of these two, remember that semimembranosus is more medial. The muscle belly of semimembranosus will be more medial than semitendinosus. Yes, some of you have given up some answers. Yes, in the butcher shop, the tendon on back of knee is used to hang up the ham. Okay, but that I think is probable as an answer. But I think according to the old English, ham or the word popple refers to back of thigh. And these muscles, they have a long belly and tendon. So that's why they're called the hamstrings, or even Ashish answer could be correct if it is taken from your textbook, I think. Okay, so just remember the word ham or popples refers to the back of the thigh. Okay, so now we're going to see these muscles. I told you laterally is biceps femoris muscle. So this muscle here, this is the biceps femoris. Whereas medially, you see two muscles. So you should be able to identify semitendinosus and membranosus separately. So I told you, this muscle, which is lateral, is semitendinosus. And when you see it in dissection, you look at its insertion, there will be a long tendon here. Okay, that's why it is named as semitendinosus. Whereas the medial muscle, which is little more bulky, okay, when we lift semitendinosus up, we can see that semimembranosus is more bulky. Okay, so and that is medial most. So please learn to identify these muscles in back of thigh. And apart from these three muscles, do you see deep to biceps femoris, there is a large muscle here. This muscle has two parts. Okay, there's an adductor part and an ischial part. So this muscle is a part of medial compartment of thigh as well as the posterior compartment of thigh. So can you name this muscle? Yes, this muscle is not labeled here. The muscle which is deep to the biceps femoris, it has an adductor part and an ischial part. Yes, this muscle is the adductor magnus muscle. Good. Okay. So keep that in mind. Now these hamstring muscles, they have origin from ischial tuberosity. Okay, they all take a common origin from ischial tuberosity. So this diagram, I think it's there in your textbook, how the ischial tuberosity is divided into different parts. Okay, ischial tuberosity, first of all, will be divided by a horizontal ridge into an upper quadrilateral area, and there's a lower triangular area. Then there is an oblique line which will divide the ischial tuberosity into a medial aspect and a lateral aspect. Okay, so this is the origin of semitendinosus, semimembranosus, and ischial part of adductor magnus. So remember that in the dissected specimen, semimembranosus is present medially, whereas at its origin, semimembranosus will be taking origin laterally. Okay, so keep that point in mind. So you can learn this from your textbook, the origin of these hamstring muscles, where it is from. So these are some common features of hamstring muscles. You need to learn it from your textbook, that they all take origin from ischial tuberosity. They all have insertion into either the tibia or the fibula. And their nerve supply of all these hamstring muscles is by tibial division of sciatic nerve. And the action of hamstrings, that they are flexors of the knee, but they're extensors of the hip. Okay, so flexor of knee is the important feature that you need to remember. Then an additional point for anyone who's interested or aiming for distinction is that out of all these muscles that I mentioned, adductor magnus and biceps femoris, they are called modified hamstrings, okay? Because in this second point, I told you that hamstring muscles, they are supposed to be inserted into tibia or fibula, but adductor magnus has its insertion onto adductor tubercle of the femur. And according to evolution, they say that the tibial collateral ligament of the knee is actually derived from the adductor magnus muscle. So suppose you answer all your questions very well in the exam. Sometimes the examiner would ask this question: what is the morphology of the tibial collateral ligament? So you can say that tibial collateral ligament is thought to be derived from the adductor magnus muscle. Similarly, long head of biceps femoris helps to form the sacrotuberous ligament morphologically. Okay, this is just an additional point. If you're interested, you can learn that. Okay, now this is something that all of you need to know. Okay, what is the insertion of semimembranosus muscle? You can type the answer if you know it. What is the insertion of semimembranosus muscle? Yes, anyone with the answer? Yes, you can type the answer in the chat. Meanwhile, look at its insertion. Semimembranosus has 3 modifications. Okay, so this is an important feature, that semimembranosus muscle, at its insertion, it will form oblique popliteal ligament to strengthen capsule of knee joint. It will give rise to fascia covering a muscle called popliteus, and it will also give a slip to the tibial collateral ligament. Yes, you've written the answer. Semimembranosus insertion is onto the, yes, groove on posterior aspect of medial condyle of tibia. That's a very important fact. Here is insertion of semimembranosus, and the tendon gives rise to these 3 modifications. So keep that in mind. Yes. Okay, now what is the attachment of biceps femoris? Okay, so out of hamstrings muscle, this lateral most muscle is biceps femoris. Can you tell me origin of long head and short head of biceps femoris? Where does it originate from? Yes, long head is from ischial tuberosity. What about the short head of biceps femoris? True over here. Short head of biceps femoris takes origin from. Yes, so now we come to an important structure you need to know called linea aspera. Okay, on posterior surface of the femur, there is a raised ridge, which is called linea aspera. Linea aspera has a medial lip and a lateral lip. So if you look closely at this diagram, just look for biceps femoris origin. Okay, short head of biceps femoris. It's from lateral lip of linea aspera. So can you see there are so many structures here attached to linea aspera. So favorite question for you in osteology, for your viva, and sometimes even asked for your theory exam as a short note is what are the attachments on linea aspera? So there are so many structures here. Okay, so you need to learn this. All of you need to know this, okay? The structures at linea aspera you need to learn from lateral to medial order. Okay, so there's a code for that, which I've highlighted in red. Okay, I think this is given in your textbook, but how you can remember it easily. Okay, so I think this weekend is supposed to be Mother's Day. And okay, if you want to learn about linea aspera, just think about a mother's love for her children. Okay, so the code is ILB and so on. Okay, so the sentence that we use to learn it is I love baby and my baby loves me. Okay, as the mother's telling to her child. Okay, so in that I is for vastus intermedius, L for vastus lateralis, B for biceps femoris, short head, M for adductor magnus, B for adductor brevis, L for adductor longus, and M for vastus medialis. Okay, so from lateral to medial aspect, this is the code for you to learn attachments on linea aspera. Now, all these vasti muscles, it's actually the origin, whereas the adductor muscles, it is the insertion, which is given in blue color. So please go back to your textbooks and make sure you learn this properly. What are the attachments on linea aspera? Okay, so now next favorite question in this region is what is the nerve supply of biceps femoris? You can type the answer. What is the nerve supply of biceps femoris? So sciatic nerve, okay. Now sciatic nerve has two components, okay. Sciatic nerve will later split into tibial nerve and common peroneal nerve. So you should mention, yes, which component supplies which head of biceps femoris. That's how you should, yes. The long head of biceps femoris is supplied by tibial component of sciatic nerve, whereas short head of biceps femoris is supplied by common peroneal component of sciatic nerve. Good. So please remember this long head and short head of biceps femoris nerve supply. So now we're just going to look at this nerve we saw in the gluteal region is the sciatic nerve. So sciatic nerve divides into two terminal branches. Yes. Terminal branches of sciatic nerve. You already know the names, I think. Okay, the terminal branches of sciatic nerve are tibial nerve and common peroneal nerve. So out of these two nerves, which nerve will be medial and which will be lateral? You can see it in this diagram. Just type it. Okay, which terminal branch of sciatic nerve is present on the medial aspect of lower limb? Yes. On the medial aspect is tibial nerve and the lateral aspect is common peroneal nerve. Good. Now, what is the level of division of sciatic nerve? I think you can see it in the figure. What is the level of division of sciatic nerve? It's a very important feature. Anybody with the answer? Which, yes, popliteal fossa. Which region of popliteal fossa? Okay, this is at the apex of popliteal fossa, is where the sciatic nerve divides into tibial and common peroneal. Yes, superior angle or the apex. Okay, good. Next is just to show you posterior cutaneous nerve of thigh. This whole area, which is colored in green, this is the course of posterior cutaneous nerve of thigh, in which it will be deep to fascia lata. Okay, so the nerve is taking origin from the lumbar plexus, and throughout its course in the thigh, it will be deep to fascia lata. Whereas in the region of the knee joint, where there is popliteal fossa, posterior cutaneous nerve of thigh will finally pierce the fascia. The deep fascia in popliteal fossa is called popliteal fascia. Posterior cutaneous nerve of thigh pierces popliteal fascia, and finally it will become superficial. You will see that. Okay, this is the last topic, popliteal fossa. I'm just finishing off the topic now because next week I may be a bit busy with clinical duty. Yes, so those of you who feel saturated, I think if you want, you can take a break, or only those who are able to stay behind. If you're having enough concentration, you can stay behind for the class. Anyway, I'll be sending the recording to everyone. Okay, popliteal fossa. I'm just going to continue. Those of you who are interested can stay behind for the meeting. Yes. So popliteal fossa is an important topic for you in discussion for Viva, also as a short note. Okay, it's a must-know topic. So this diagram is given in your textbook. Popliteal fossa is a depression which is present on the posterior aspect of the knee. It is a diamond-shaped fossa. So you need to know what are the boundaries. Okay, this diagram already shows you the boundaries. Supralaterally, there is the long and short head of biceps femoris. Supromedially, there is semimembranosus and semitendinosus. And you can see the semitendinosus has a long tendon. Infromedially, there is the medial head of gastrocnemius, and infrolaterally, there is the lateral head of gastrocnemius along with a smaller muscle called plantaris. Okay, I know these are all probably new names for you, but please start reading about these muscles. These are the boundaries of popliteal fossa. Next, we're going to see the roof of popliteal fossa. This fascia is called the popliteal fascia. And here I told you the posterior cutaneous nerve of thigh, it pierces the popliteal fascia and finally becomes superficial. And in roof of popliteal fossa, there is also the short saphenous vein. Okay, you've already seen great saphenous vein on medial aspect of thigh. So here on posterior aspect of leg. And finally, in the roof of popliteal fossa, there is the short saphenous vein. Floor of popliteal fossa. Okay, so when you are dissecting the popliteal fossa, you're actually reflecting the skin from posterior aspect of the body and you're going deeper. Okay, so the floor of popliteal fossa will be the deep structures. That is, okay, floor you divide into three parts: upper 1/3, middle 1/3, and lower 1/3. So upper 1/3 of floor of popliteal fossa is formed by popliteal surface of the femur. Middle 1/3 of the floor is formed by capsule of knee joint and a ligament called oblique popliteal ligament. And lower 1/3 of popliteal fossa is by fascia covering the muscle called popliteus. Now I want you to remember the muscle popliteus. Okay, popliteus is called the key muscle of the knee joint. So what are the contents of popliteal fossa? Okay, you have to learn this diagram from your textbook. There are two vessels, which is the popliteal artery and popliteal vein. And at the superior angle of popliteal fossa, sciatic nerve divides into its two terminal branches. So as contents in popliteal fossa, you have to mention tibial nerve and common peroneal nerve. Apart from this, there are popliteal lymph nodes and popliteal fat and two other nerves which are present here. Okay, in part of popliteal fossa, there is also posterior femoral cutaneous nerve, and there is another nerve, a branch from obturator nerve, which is called the descending genicular branch. That's given in your textbook. So at least the important structures all of you have to know. So this is the dissected specimen to show the boundaries and contents of popliteal fossa. Okay, so this diamond-shaped area is the popliteal fossa. Supralaterally boundary by biceps femoris, supromedially, here this long tendon that you see with muscle belly and the long tendon. This is semitendinosus. This is semimembranosus. Infromedially is medial head of gastrocnemius. Infrolaterally is lateral head of gastrocnemius. And there's also a muscle deeper called plantaris. Okay, just to show you plantaris muscle. This medial head of gastrocnemius and lateral head. And here they have elevated the muscle, which is plantaris. Plantaris muscle also has a long tendon. Next, the contents of popliteal fossa. Okay, from medial to lateral, you should know the order of structures. Okay, so please keep in mind, from medial to lateral is popliteal artery, popliteal vein, and the nerve is actually the tibial component of sciatic nerve. So that is the neurovascular bundle within the popliteal fossa. So this diagram is also given in your book. So this is very important about how the neurovascular relations in the upper part of popliteal fossa is from medial to lateral, AVN. Whereas in the middle of popliteal fossa, the popliteal artery will cross. Okay, remember popliteal artery is the deepest structure in popliteal fossa. It will cross to the lateral aspect. So in lower part of popliteal fossa, the relations are NVA, okay, or lateral to medial is AVN. So please keep this in mind, how the neurovascular structures are related in popliteal fossa. Now, can you tell me popliteal artery is a continuation of which artery? Popliteal artery is a continuation of, and what is the extent of popliteal artery? Yes, popliteal artery is a continuation of femoral artery. And what is its extent? Okay, look here. This is, if you remember, adductor hiatus. Okay, adductor hiatus is an osteoaponeurotic opening in adductor magnus muscle. From adductor hiatus up to lower border of popliteus muscle is the extent of popliteal artery. Yes. And popliteal artery divides into two terminal branches. What are the terminal branches of popliteal artery? Some of you have already typed the answer. At lower border of popliteus muscle, popliteal artery divides into two branches. What are the terminal branches? Yes, and some of you have already typed it as, yes, anterior and posterior tibial arteries. Good. Okay. And you need to learn about, apart from terminal branches, there are other branches also. Okay, you can see it here in the diagram. On the medial aspect, okay, there are superior medial genicular artery. Similarly, inferiorly, there is inferior medial genicular artery. So there are genicular arteries on the medial and lateral aspect. So these arteries, okay, the word genu means knee. So genicular means these are arteries which are going to be supplying the knee joint and the muscles in that region. So in lower limb, we had mentioned, if you're interested, you can learn about anastomosis around scapula and anastomosis around the elbow. Similarly, in lower limb, you have to learn about anastomosis around the knee. Okay, it is rarely asked in your exam, genicular anastomosis. Sometimes asked for you. Okay, now we just learn about a few clinical aspects about how do you palpate or how will you feel the popliteal artery pulse. So here you can see the doctor examining the patient. The knee of the patient needs to be at an angle. Okay, so at what angle will you flex the knee of the patient for examining popliteal artery pulse? It's given in this diagram. At what angle should the knee be flexed? You can type it in the chat. Anyone with the answer? How will you feel the popliteal artery pulse? Okay, I'll just continue then. You can see in the diagram that the knee of the patient is flexed to 60 degrees and you need to place the fingers, the tip of the fingers you should put deep into the popliteal fossa, whereas the thumb will be resting on the anterior aspect of the knee, on the patella. So please remember, in this figure, the knee is not flexed, but you have to flex it. Okay, tip of finger go. You have to feel deep into the popliteal artery. Deep into popliteal fossa, and you'll be able to feel the pulsation of popliteal artery compressed against the femur, the popliteal surface of femur. So please read this in your textbook. Palpation of popliteal artery pulse is very important. Now, can you tell me any more clinical anatomy of popliteal fossa? Okay, this is the last part of the class. You can type your responses. Okay, clinical anatomy of popliteal fossa. Suppose patient comes to you with a swelling like this at the back of knee. What is this swelling? Yes, could be popliteal aneurysm. Now, aneurysm means it's a swelling of the artery, a dilatation of the artery. So if it is an aneurysm, popliteal aneurysm, it will be pulsatile swelling. When you feel the swelling, you can feel the pulse. Then some of you have mentioned Baker's cyst. Good. Okay, Baker's cyst is actually a soft swelling which is arising from the synovial membrane of the knee joint. Okay, it is, you will learn later, the bursa is present in the knee joint deep to semimembranosus muscle. So if that bursa gets enlarged and inflamed, it leads to a soft swelling in the popliteal fossa that is called Baker's cyst. Okay. So you need to be able to differentiate these swellings clinically. Okay, this is important for you when you are learning general surgery later. If patient comes with swelling in the popliteal fossa, you have to be able to understand if it's popliteal aneurysm, it will be a pulsatile swelling. What about Baker's cyst will be a soft swelling? What about popliteal abscess? If there is pus collection, how will you understand? How will you differentiate an abscess from the other swellings? Does anyone know the answer? Okay, popliteal abscess. Can you guess how to differentiate from Baker's cyst or an aneurysm? This is the clue for you. Okay, this is how the abscess will look. So what are the differences between a popliteal abscess and Baker's cyst when you're examining? Just mention one or two differences that you see. It's easy. Yes. Abscess will be painful. Okay, when the doctor touches the swelling, it will be painful. Pain on touch is called tenderness. Yes, it will be reddish in color. And also when you feel it, it will be having warmth. Okay, there'll be a higher body temperature in the region of abscess. So why am I teaching you this? How to differentiate the swellings? Okay, in your surgical postings also you need to differentiate, and as a doctor also you need to diagnose properly, because the treatment of popliteal abscess is incision and drainage. Okay, the doctor will place an incision over the abscess in order to release the pus. But before you do incision and drainage in any part of the body, you need to make sure that it is indeed an abscess and not some other swelling. Because imagine if it is a popliteal aneurysm, but if the doctor misdiagnoses it as an abscess, and if the incision is placed, then the patient will have severe bleeding, and it is more difficult to revive the patient after massive blood loss. It's a very difficult situation. So when you see a patient with a swelling in popliteal fossa, you need to keep in mind that there are so many causes, or even anytime you diagnose a patient, you need to keep in mind not only one particular diagnosis, but what else could it possibly be. So that will help you to treat the patient correctly and to avoid any serious complications like this. Okay, so these are just a few topics that you can read up, and I'll send this to you so you can note it down. These are the essay questions and short notes from this region. And these are your discussion topics. These are frequently asked. For your viva, for 10 marks, there will be specimens above diaphragm and below diaphragm. So these are the topics. These are the extra questions for those who are interested. It is given in your textbook. You can try to find out these answers. And if you have any doubts, you can ask. Okay, so that's it for today's class. I think we have 5 minutes left. Okay. Yes, you can. I just have a small story to share at the end of class. So those who are interested to hear that, you can rejoin the meeting. I'll just end the meeting and restart. Okay, those who want to listen 5 minutes extra, you can rejoin the meeting.